What is the problem?
ഇവിടെ വേദനയാണ്. ഈ കൈ കൊണ്ട് ഒന്നും ചെയ്യാൻ പറ്റത്തില്ല. അപ്പോൾ വേദനയാണ്. ഇവിടെ.
Yes, okay. Now push my hand up. Up, 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 up.
ഡോക്ടർ വേദന.
Okay. Just relax. Here.
അയ്യോ.
What she has is an entity called tennis elbow. Tennis is a power game and it demands enormous physical muscle power and stamina. A backhand stroke requires phenomenal power at wrist, which is generated by the extensor group of muscles at elbow. This may sprain the tendon or even may rupture at the time of a game. This is the point of attachment of the extensor muscles at elbow, and here this is the site of pain as well when it sprains. Although it is called a tennis elbow, most of the victims are common people who have nothing to do with tennis. When people who are physically very weak and attempt to perform even a slightly heavier work, the muscle sprains and result in tennis elbow. More common are ladies who are weak and habituated in doing domestic work day in and day out. It causes pain even with very simple activities like opening a lid or tightening a lid, cutting vegetables or meat on a cutting board which requires some power, ironing a dress, watering plants in a garden, simple pouring of tea from a jug onto a cup. Practically, it disables a lady from doing anything. When the insult is inflicted, it should be treated same like sprain anywhere else in a major joint like knee, ankle, shoulder by immobilizing the joint with splint for 3 to 4 weeks. But majority take it lightly and they ignore. Once 3 weeks are passed, it doesn't heal. It leaves a gap at the site of injury and it becomes a chronic inflammation. Even loads of painkillers may not benefit. Wrist brace has been tried, but it relieves pain only when you wear it. The moment you remove it and start moving the wrist, the pain recurs. Elbow brace is an alternative to wrist brace, but worse than the wrist brace. The results are not gratifying. Local steroid injection at the site of pain has been an age-old practice. It helps for some time, maybe a few weeks or months, but it will recur. But the irony is, when it recurs, the pain is much worse than before. People with tennis elbow are usually very frustrated and curse the medical field for its inefficiency to give remedy for such a simple pathology. In my experience with over hundreds of patients, local injection with PRP, that is platelet-rich plasma, which is a cell extracted from your own blood and injecting into the site of inflammation, helps a lot. It promotes healing. Usage of plasma for face in beauty centers is familiar to ladies. The same plasma has got another effect, and that is relieving chronic pain. A syringe is being smeared with the anticoagulant solution. 15 cc of blood will be collected from your arm. It will be filled into a special container, centrifuged in laboratory for 10 minutes. Plasma and PRP are isolated in 2 different syringes, injected into the site of pain. This procedure is an outpatient procedure, takes totally about 30 minutes, almost painless. You can come, have it, and walk back home. To say, the first injection will be on day 1. After 3 weeks, you take the second injection. After another 3 weeks will be the third injection. The total duration of the course is 45 days. At the end of it, you can expect 90 to 95% relief from tennis elbow.